over to you, Sis Q.
Good morning, Ron. Good morning, Ron. Good morning, colleagues. How are you?
We are fabulous. How are you?
Very well. Thank you for asking. Can I take it away?
It's over to you. Take us away.
Thank you very much. The news this morning from Path SA are brought to you by SISQ, the founding member of Path SA itself. The time now it is 9 o'clock. Please allow me, colleagues, to present to you the population size estimation of transgender people in South Africa. Please confirm if you can see my screen.
Yes, we can.
Can you?
No.
Okay.
I think just go ahead and share and see.
Okay.
Oh, there we can see. Thank you.
Excellent.
Thanks, Selma, for confirming. Colleagues, as I've said, I'm going to be presenting on population size estimation of transgender people in South Africa. Beyond Zero and the campaign hashtag Unmute Me has developed this campaign to respond or address the needs for culturally competent healthcare providers and administrators who can help end the health disparities faced by tissue people in the context of South Africa. I hope me. The study was focused on the fact that the population size of tissue persons in South Africa is not well, in part because of official records, including the national census, as it does not include data on gender identities. This is the objectives of the study was to estimate the population size of tissue persons in South Africa and also to establish a comprehensive geospatial map and database per district where we are implementing. Out of the 52 districts, the sample size conduct the study. These are some of the population size estimation of transgender people as by method. Colleagues, I'm not going to go through cell by cell. However, I'm more than willing to share on emails. If colleagues can drop their email addresses on the box chat, then I will share the soft copy of this study. Is that okay with you, colleagues? I hope so. This population size estimates for transgender people in South Africa by province, and this is the data that is talking to the findings. As I conclude on this study, colleagues, the transgender population size estimation will go a long way in informing program and policy in South Africa. it has emerged that there is an estimated 179,327 transgender people living in South Africa. Effective implementation of the population size estimation project was a result of the collaboratively measure with various transgender focus organizations. A combination of wisdom of the crowd, service multiplier, and respondents-driven sampling method were used. In the context of COVID-19 pandemic, use of online data collection links coupled with social media players played a critical role in reaching out to transgender people and transgender focused service providers in various districts. I'm now going to move over to the second presentation, colleagues, which emanated from the midterm review, as it was the contractual obligation by Global Fund to test the effect of our services to transgender people in the district where we are implementing. The methodology used here took shape of the tripartite layers as dispensed by the HIV prevention program, which is behavioral, medical, as well as structural components entrenched on peer-led approach implemented through recipients. The study was meant to describe service delivery approaches, document barriers and facilitators to accessing health services for TG people, and the larger structural influences on sexual and health-seeking behaviors. Focus groups were conducted with in-depth interviews with policymakers and key informants as well as transgender people. A good SA policy framework overlaid by poor implementation of the policies was reported through this midterm review. Beneficiaries of the policies do not know the policies that relates to their health.
Yes, we're having some technical challenges.
Hi, colleagues. I believe you have lost me. I was disconnected and I was not aware I was running through my slides.
You just want to, can you bring your slides up again, Saskia?
Can you now see around my slides?
Something, yeah, it's coming up. Okay.
Just click on slideshow at the top.
I did, but the response of my PC, since the network is bad, it takes a while.
We can see you're on the screen now, yes.
Thank you very much, Ron. I guess what was missed on my presentation was on evaluations. As I was saying, a good SA policy framework overacted by poor implementation of the policies was reported. Beneficiaries of the policies do not know the policies that relate to their health rights. The issue of gender diversity came up strongly during these in-depth interviews, as the health care services are designed in a binary approach and has no consideration for non-gender conforming groups. Competency in the clinical space was highly acknowledged, however, regarded poor in implementing, observing, and embracing gender diverse population in healthcare settings. The provision of hormone therapy was one of the most important discussions that came up strongly during this in-depth interviews when we did the midterm review of our implementation on HIV prevention. As I conclude, colleagues, it was recommended that Beyond Zero develops a successful and sustainable implementation model that addresses the identified gaps. For Beyond Zero to achieve these suggested implementation models requires collaboration of all stakeholders stakeholders present on this space and the other ones that are not present, such as our SANAC, our PACs, civil society, hospitals, as well as the National Department of Health, to work together in changing policies to embrace transgender in South Africa. Colleagues, that will be all from my end this morning. Thank you so very much.
Thank you, Sis Q. So I'm open to facilitate some questions from the audience. If I may use my privilege as the facilitator, Sis Q, just one of my first, one of my questions was looking at your population size study. With what you were anticipating before the study and the population size number that your study produced, what were some of your takeaways of your team? Were you surprised by the outcome or not?
Thanks, Ron, for your question. To begin with your last question, I wouldn't say we were surprised by the findings of the study, because already we were transgender people. What was in each district in South Africa, so that we can be in a position to extend our geographical service provision to the district that perhaps requires such services with forgotten population, as it was indicated that the study has not been done before. I hope I have sufficiently responded to you, Aaron.
No, thanks, Q. I guess another part of that question was, because as your study is making an important contribution, this is an area when it comes to prevalence, of gender diversity. We have very little to no data in South Africa and Africa. So this is probably one of the, the first studies that's contributing to that. So I can't recall. I know there are some international studies that also have done some prevalence, investigations. So how does the prevalence that you have found in this study compare to the prevalences with international studies? Has such a comparison been done yet?
Thank you again for your question, Ron. I'm going to be honest with you. I don't recall us comparing our findings as yet with the international studies that have taken place. However, I think it's something that we can consider in the future, and then perhaps when we assemble again, we can give full report to your question. I hope that is okay with you, Ron. Thanks.
No, absolutely. Thank you. It struck me when SOC 8 was released, they did, they collated a lot of comparative, studies that have been done around the world. And that is the question, that's in the air. So absolutely, do come back to us. Any questions from the audience on the population size study and the barriers to gender affirming healthcare, which was Siskiyou's second presentation? Questions or comments or reflections? Seems we do not. Oh, there we go. Pierre, do go ahead.
Thank you, Ron. This question of population size estimates has come up in another seminar series I've been involved in, where we're looking at how social surveys can include data on sexuality and gender so that they are more inclusive. Because I suppose if you don't ask those kinds of questions in large-scale social surveys, in a sense, the queer community is invisibilized. But just thinking about the number of 180,000, I suppose there's often a risk attached to this, which is that the broader society can say it's a very small number of people. Why do we need these kinds of interventions? I mean, everybody in this room I mean, gets the fact that we live in a particular kind of democracy that recognizes all forms of diversity, no matter how large or small. But is there a sort of a way to think about the number in a way that is more strategic, I suppose, is my question.
That is a tricky one, Pierre. I think what I can do is maybe we can attend to that question beyond this platform, as I don't think I am capable enough at the stage to give you a sufficient response to it. So if maybe you can share your email address with me, then we can connect beyond this platform. That would be great. Thank you so much.
Thank you. I think my address was in the chat for the other resource, but I wonder if other people have a thought. Naomi, I see your hand is up.
Thanks, Pierre. Morning, everybody. Thank you so much for your presentation. I just wanted to add a comment. We were recently this week at a meeting called a data summit around key populations.
Naomi, your volume is slightly, it's softer. Is there any way you can maybe make it a bit louder? Sorry. We can hear you, but it's quite soft.
Yeah. Is that better?
I think just go ahead. Yeah, it should be fine. I think it's audible, just soft.
Okay, great. I'm just lifting up my laptop to be closer to my microphone. I was saying, I'll start again. Thank you for the presentation. I just wanted to comment on some of the current trends in population size estimations that were mentioned at a PEPFAR meeting that Rutendo and Jolie and myself attended this week. And in addition to the broader population size estimates, there's also a trend towards what's called small area estimates, which is really a more granular process where you take a local area and you do an in-depth dive into the various social, behavioral, and economic and various other sort of data points impacting on that population. And although it tends to be, from the PEPFAR perspective, very much driven by a HIV agenda, I still think that it's a useful opportunity to use donor funding to gather more information for and with the trans and gender diverse community that could be very useful for service delivery design. So I just wanted to add that piece in. Thanks.
Thanks, Naomi. Siskiyou, there's a question as well. You did mention in your presentation the number. Madeleine just asked whether there was an overall prevalence percentage that was then calculated. You did mention the number of trans and gender diverse persons in total. Was a percentage, prevalence percentage calculated?
Thanks, Ron, for raising that question from Madeleine, and thanks, Madeleine. There wasn't necessarily a percentage, but rather a whole overall number that I have given on the slides. I think Madeleine can engage with the copy that Elma has shared on the comments above her question. I think that will also help in answering her questions. Thank you so much, Ron.
Thanks, Siskiyou. Elma, your hand is raised. Go for it.
If one looks at that study, it does mention 0.3% of the population, which is similar to older international estimates of about 0.3% or 3 per 1,000 people. And I'm so delighted that that is an estimate, but at least we've got a figure so that when Department of Health wants to start look at what is it going to cost to put hormones into the primary care EML, we can say to them, there will be at least so many people. 0.3% times the population of South Africa is how many people we need to be ready for. And it's really wonderful that there is an estimate that kind of aligns with the international data, although the international data, it depends on the definition of how you define trans and whether you include gender diverse and whether you have more younger people participating, because the prevalence seems to be more. But yeah, it's a fascinating discussion, and thank you so much, Sis Qhawe, for presenting that important work.
Thank you, Alma, and thanks, Alison. Sis Qhawe, Alison's put, if you got your eye on the chat as well, that a similar estimate was found in a study in Canada. So similar to what Alma is saying. So this finding is, situating us with research being done here in South Africa, and we seem to be aligning, with the international arena. Are there any other comments or reflections or questions for Sis Qhawe? I know we've reflected, and there's been questions with regards to the population size study, with regards to the health services delivery to transgender people and policy implications. Any comments or questions there? Are we good? Excellent. So thank you, Sis Qhawe, for your presentation of your two studies. We really appreciate it, and for making it available